Well, hey everyone, welcome back. I have a very special guest that might be familiar to all of you, and her name is Dr. Teresa Alasio. Welcome back. I'm so glad you're here.
Hi, Rhonda. I am so glad to be back with you today.
Yeah, our last conversation was very popular. I had lots and lots and lots of feedback about it, and it was on the topic of lichen sclerosis, this underdiagnosed condition that affects millions of women, I would venture to say. And it's no one really talks about it. It's not dinner table conversation by any stretch of the imagination, but it was such a good conversation. I wanted to have you back on the podcast to talk about what we kind of alluded to there, and that is that autoimmune conditions we know that they are deeply rooted in the gut. So today, I would love to chat with you more about what you're seeing as an MD, not only a pathologist and an MD, but your work with the gut. I want to talk about how we manage gut cases from an alternative perspective and what we might be missing. So, look, before we get there, for anyone who's listening that didn't hear about you before, would you just bring us all up to speed about your background and what you love and how you got into medicine and all the things, and then we'll dive into our topic.
Okay, great. So I'm Dr. Teresa Alasio. I am an MD. I was born and educated in New York City. I went to school at Mount Sinai School of Medicine more years ago than I can count. We don't count anymore.
No, we don't count.
No, but I have nearly 20 years of clinical experience. I've worked in pathology for most of that, looking at biopsies and also having some interactions with patients. A couple of years ago, I started really investigating and becoming sold on the practice of functional medicine. Just made more sense to me. And I've found a wonderful community of practitioners and a whole bunch of ideas and testing options that people who can avail themselves of, which is just incredible. And Western medicine people don't really know very much about. So I just fell in love with that. I fall in love with the idea of root causes. I think that that's really what has sold me so much on this specialty. And I would love to bring it more to the Western docs. It's not that easy, but I can do what I can.
And I love that you have, I always say, welcome over to the light side. You left the dark side and you came over to the light side. But really, it's not a dark side and a light side. It really is just, it's just information that the Western medicine doesn't have. And because they're, to some degree limited and they're in a box and they can't get out of the box and they've got regulations, requirements at AMA, all the things. And so sometimes it's hard to kind of step out of that and consider that what you were trained in may not be the best way. And you have to or have 100% of the answers. I'll say it that way. And you find that there's a whole new world out there of diagnostic tests or procedures, things that you can do that are going to make such a difference for the patient and not leave them having to deal with, medication overload and all the things. So as it has to do with the gut, talk about I want to know why you became so fascinated by the gut.
Oh, because of my own personal history.
Yeah, like how did you decide the gut was your bailiwick?
I tell you, as I mentioned, I have read thousands of biopsies, all kinds of GI stuff, like I can't even count, right? But a few years ago, I had my own bout of, I got to say, like I was not doing well with gut. I had a lot of symptoms, went to GI and traditional Western GI and said, hey, I got this going on. I've had, diarrhea for a couple of weeks. This is not good. And he says, well, all right, well, let's do stool for over and parasites. And here's a Z-Pak. Have a nice day.
Yeah.
I'm like,
oh gosh.
Okay. That didn't quite work. Eventually resolved, but I was never not just really quite right.
Yeah.
And a couple of years ago, I went to a course. It was called anti-aging, just anti-aging, and the instructor was talking about the GI map test and talked about all this functional medicine testing. And I'm like, well, what is this? And I was really fascinated by it.
I love that.
And so honestly, I ordered a GI map. And I said, well, let's see what this shows. I have symptoms. I've got stuff going on. Let's see. So I did. And wouldn't you know, comes back all out of whack. Dysbiosis, some little H. pylori percolating there, little bacterial overgrowth. And I'm like, oh, well, this is why. This is what's going on. I'm like, this is crazy. So I researched a little bit. I put myself on, good probiotic. I modified some diet, lifestyle stuff. And you know what? It resolved. I'm like, well, there is really something to this. So woohoo. So I went on and I said, all right, this is going to be part of my arsenal, because I'm opening a new practice, a brick and mortar practice, but I also am carrying on an online business which deals with gut health. And I just dove right into it. And this is amazing. And I started working with clients who have had similar issues of my own. I have found that, the testing is really the first start. You can really get so much information without, putting a needle in somebody or putting a scope in somebody. You don't need to do all of that. You can just really, very plainly, you can just look at their poop and see what's going on.
Well,
It's very, very simple.
And we know that, all disease begins in the gut. And we know this, right? We absolutely know this. So having the gut be a focal point of any practice is never going to be a bad thing. And so many people have digestive issues, whether they are upper digestive issues, as in stomach, gallbladder, bile, pancreas, up top, or middle having to do with absorption, bloating, dysbiosis, lower being infection, dysbiosis, etc. There's problems. Can problems start in the mouth, end up all the way down at the end of the tube, and anywhere in between? So having that focus on the gut is always going to be a good thing. What is the top aha moment that you had as an MD looking at the gut and seeing the correlation between the disease process in a person and what could be done? In other words, what is an aha where your eyes just went, oh my gosh, this is connected?
I would have to say, if I had to name one thing that really surprised me and I was amazed by, was, dealing with treating H. pylori infections in clients.
And why is that?
It is because after years and years of reading gastric biopsies with or without H. pylori, they always think it's H. pylori, and I don't find it. And how taking a biopsy only takes a piece of somebody, and you look at it under the microscope and you either see the bugs or you don't see the bugs. But if you do, for example, if you do GI map testing or any other of these other tests that look at stool samples and can detect H. pylori, the amount of prevalence that H. pylori is there in the population is much more than what a little GI biopsy would be able to tell.
And to your point, it's one sample taken from one location. And if the bug doesn't happen to live there, then the diagnosis is negative. And I've always said that about a parasite test, just for the sake of a parasite test on the Western medicine side. And that is, a patient comes in and says, well, my doctor tested me for parasites and I don't have them. And I say, okay, well, so they tested you for 10 parasites. What if you have number 11? You're never going to know. And the test is going to come back negative, but you still feel crappy. So I love that you're really diving in and doing more investigative work with the gut. So you have H. pylori as being a contributor to pathology or symptoms, unpleasant digestion, inability to break down food, reflux, all the things that we know H. pylori is involved with. What would you say are some of the other things that as practitioners we may overlook as it has to do with stool testing, right? So if a practitioner is going to order a stool test on a patient to get more information, to get a map, GI map, in this case, a map of the terrain and what's happening in there, what are some other things? Where might we be missing the mark, would you say, based on your training? Other things that could be contributing to this altered gut?
There can be a bunch of other things that contribute. So your GI map, okay, so you want to look at the stool. That's fine. You can look at that. But what I think we need to be looking at is the whole patient, your whole client, your person sitting in front of you. we look at the whole history, right? So who are they? Do they do a job? Do they not do a job? Are they stressed out? Are for whatever, why are they stressed out? What kinds of external influences do they have? And what is their mental state, right? You
Right.
know, we talk about H. pylori infections and all of the physical symptoms, but you know, do they have brain fog? Are they depressed? Are they anxious? Are they experiencing any kind of the effects that are psychological, behavioral, that can be related back to the gut? You know, I mean, if you look at 95% of serotonin is
Right.
produced in the
In the
gut.
gut. Totally.
And if your gut is off and you have reduced serotonin, you're depressed,
Yeah.
you
Are you
know?
a fan of supplementing with serotonin or adding specifically like precursors to provide serotonin or so the body could generate it? Or are you more of a fan of fixing the gut to allow the gut to produce those neurotransmitters? I'm curious which side of the fence you're on because it's definitely a line. There are practitioners on both sides of that fence.
Well, fixing the gut might take longer, you know.
Yeah.
So that's one thing that you'd want to consider, because you know, people who, it would all depend really on your individual patient. What are they going through? What is their priority list of issues? You know, maybe you have to, you know, look at their behavior, their depression, their anxiety. That's number one. For some people, it's not. Maybe the gut symptoms are, you know, overtake that. You know, I think that it has to be dependent. What you do has to be dependent on tailored to the person that you are looking at in front of you. But I mean,
Yeah.
if you want to look at patients, you know, from that holistic perspective, you need to address what they're confronted with in their lives in terms of, you know, behavior, depression, the mindset. Do
Right.
they meditate? Do they breathe? Do they move?
Yeah, moving is huge, 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 huge for
Huge.
brain health and gut health, huge. So,
Totally huge.
what would you say the role of stress and the gut is? How much emphasis do you put on that?
I put a lot of emphasis on that.
Why is
I
that?
think because stress will raise your cortisol levels. Cortisol causes your inflammation to soar, and inflammation is no friend
Right.
to your gut. I mean, inflammation has its place, definitely, right? But systemic inflammation for a chronic and long-term period of time is not good for your gut or for any part of your body.
Yeah. So, what about mindset? You know, stress sometimes comes down to managing your thoughts. Now, I don't want to discount the fact that, you know, we have all had patients who really do have a strong amount of anxiety or whatever's happening in their life, whether it's real or perceived, internal, external. There's a healthy level of stress. And then there's this high level of stress. But sometimes people can get in their minds where then they're worried about things. You know, I know people like this. They think about it and they worry about it and think about it and they worry about it and they worry about it and they worry about their health and they worry about their kids and they're always worried about something. That's going to have the same effect in disrupting the microbiome as a frank stress of getting up, not getting enough sleep, you know, too much alcohol, too many late nights, too many early mornings, all of that stuff. Would you agree with that? And if so, what would your direction or recommendation be? Like from a practitioner perspective for that patient, what would you recommend in that situation?
Well, first, to answer the first part, I definitely agree with your statement. I also think that the brain does not differentiate between being chased by the tiger, the stress of being chased by the tiger, and the stress of modern life. You
Right.
know, your body sees it the same way, your brain
Yeah.
sees it the same way, right? So what I'm saying is also that stress is as old as people,
Yeah. We
right?
can't get rid of it. We can't get around
We
it.
can't,
Yeah.
no, you can't get rid of it.
Mm-mm.
I think one thing that is so important is that like, going back to looking at the patient in front of you. Like, are you stressed? Are you okay? Just even saying to somebody, are you okay? That can trigger a lot,
Mm-hmm.
you know?
A great
Um,
question.
yeah. And who asks that question these days? They don't ask it.
I think sometimes we don't ask because we're afraid of the answer, or we feel like we don't know how to handle the answer. What if the patient falls apart in the office, or what if they say, I'm not okay and this is happening and this is happening, and then the practitioner's like, I don't know what to do. I don't know what to do. So I think sometimes we don't ask because we might be afraid of what they're going to say, but it is such a powerful question because it's so open-ended.
Well, I tell you, we're afraid of the answer because of our own bias and
I
our
get it.
own
I
fear.
agree.
It's and it has nothing to do with that patient,
Right.
you
Right.
know? So you know, in coaching circles, it's called, coming from a clean place. You need to come from a clean place when you talk to your clients. You don't bring your own stuff into that room.
Right.
It's not about me. I can have whatever's going on outside that door, but when I'm sitting in that space with that client or that patient, it is my job above all to hold space for that person.
So good.
Doesn't matter what I'm
So
doing,
good.
right?
So I love that.
Yeah, and it's coming from a clean place, meaning, you don't get in the pool with them and be
Yeah.
like, oh yeah, I know, and I can talk about all this stuff. I'm not going to muddy that water. That's their time. That's that person's time.
Yeah.
Right. So I think that's really important to remember when you talk with patients and clients, for whether you're coaching them or you're talking to them in your office as a practitioner. And it's not so bad to actually keep that in mind.
Yeah.
You
Yeah.
know, when we talk to our clients or our patients, they're they're not our friends. We love them, but we want to take care of them,
Yeah.
but it's not an equal relationship. We are there for them. We are there to hold space for them.
And guide them and help them achieve the outcome that they're wanting to achieve. So
And
if,
sometimes this is exactly what people need. They need to feel heard, they need to feel listened to,
yeah,
and they need someone to hold space for them. And that is what will help cultivate that relationship with them.
and reduce stress.
Oh,
Right. Just that
100%.
right there, knowing that they have that place to come. I like right there, that, my dear friend, is the gem of this conversation, I think, is that holding the space for them and coming from a clean place so that there's no bias, there's no judgment, there's no nothing. But when you walk into the room with a patient, that there's just a big open arms and a lot of room to just let what is going to happen without judgment, and allow them to be able to express what it is that's going on in their life. Because if they don't have the ability to either communicate the stress that they're under, the mental load that they're under, the family dynamics that are, causing them issues, if they don't have a place to be able to communicate that, then you're going to just be chasing symptoms and trying to put out fires with supplements or herbs or whatever it is that you're giving. So this is so good. This coming from a clean place and really allowing them to share openly, and I think we all want to do that, but I think sometimes we forget. We just come in with an agenda like, okay, you got Hashimoto's, let's go. We got to do this. We need to get you on this. And I think sometimes we forget. I do anyway. I just go in with my agenda because I want to get stuff done. And
Yeah.
I
Yeah.
forget.
It's really hard to keep that in mind. And I mean, imagine if you had to go and see 20 patients or 30 patients that day. And maybe you do. Maybe, some people who are listening have to, and that is very hard. But the fact is, you don't need that long.
No. This doesn't mean it's an hour conversation. It's just really giving them
No.
the space. Yeah. Yeah.
No, giving them the space, but just dropping all of your own stuff.
Right.
Drop your
And
stuff.
this is kind of a little bit of a mic drop, I think. The way for us to wrap up our conversation is to really think about the role, the fact that these patients, and ourselves too, I mean, I would say all of us, are feeling stress. We're feeling at least right now today, at the time of this recording, we're feeling, economic pressure. There's political pressure. There's world pressure, world national government kind of pressure. There's, putting food on the table pressure. There's all these things that are happening outside of our world that we have little to no control over. And some do better at managing and assessing and I should say, putting that in context inside your life and your belief system to not let it affect you like that. But I can say from my own practice and the friends, people that I know, that many people can't, they're not doing well right now. We're 3 years COVID, post COVID, or into however you want to language that. So we've had a lot of stress lately. And so more and more people have been exposed to that chronic long-term stress, and it will dysregulate not only the gut, but it dysregulates our ability to connect with people, to do our jobs, to show up for work. It's going to mess up blood sugar. Like the list goes on and on and on. But if we're going to tie it back to the gut, I think as a clinician, please like jump in and add anything else you would say. But I would definitely say if there's a gut issue, that this conversation about their stress, how are you doing? And holding that space for them has got to be something we've got to consider and at least keep top of mind a little bit more often.
I definitely agree. And the only thing I would add to anyone who is a practitioner and for all of us, one very important thing is that give yourself some grace and give your patients grace.
Yeah.
Not everybody can verbalize what is bothering them, and it doesn't always come out in the prettiest way. But you know what? If we give ourselves grace and we say, well, you know what, I'm trying, I'm doing a good job, that goes a heck of a long way.
And let the patient know too, the same thing, you have to believe in yourself, give yourself grace, but then when you give them grace, we can give them grace in our minds, but sometimes going that extra mile and just saying, listen, I've got lots of space for you. We have lots of time and I'm on your team. Like let's go. You and me together, we're on the team together. And sometimes, you might, as a practitioner, you may be the only person in their life that really believes in them and hears them. And sometimes that's true.
Yep, it is.
Well, Teresa, thank you so much for being on the podcast with me today. Like I literally kind of don't know what to say. This is really this last little bit here, especially has really impacted me about holding space and coming from a clean place. And I'm going to be really thinking about that. I actually have some patients I have to work with today. And so I'm going to be very intentional about listening from a clean place intentionally. So thank you. That was gold for me.
I'm so glad we had this time to talk. Thank you so much.
Thank you again so much for being on the podcast with me. I have loved this conversation. Thank you so much.